Good afternoon. I'm Jade Clark, Digital Programme Manager within the Cardiovascular Disease Prevention team at Public Health England. I'm also joined by my job share partner, Rosie Taylor, and Andrew Lloyd Harris, who is organising the webinar for us today. To give a bit of context and introduction to today's webinar, I probably don't need to say too much about the proliferation and the use of digital technology, which has happened over the past several years and has escalated considerably during the past year of the pandemic. Prior to the pandemic, the groundwork had already been set for an exploration of what digital could add to the NHS Health Check, with the government's Prevention Green Paper Advancing Our Health, which highlighted the need for intelligent health checks, and also the DHSC Prevention is Better Than Cure paper, where the Secretary of State for Health puts both public health and technology at the centre of the health agenda. Plus the NHS Health Check review, which includes consideration of opportunities around taking a digital first approach to the programme's design and delivery. We're currently in a really exciting era where digital products and solutions have the potential to offer cost-effective, targeted support for chronic disease risk assessment, onward referral and lifestyle behaviour change as part of the preventative health agenda. And as part of our exploratory work on digitalisation of the NHS Health Check, PHE has commissioned Orca, which is a digital assessment company, to identify and assess digital health products and services that are capable of delivering the key elements of the current NHS Health Check. Our intention following completion of this assessment work will be to test a small number of these products in the field to assess the benefits and challenges of using a digital approach for delivery of the NHS Health Check. We've already had some expressions of interest from a small number of local authorities who are keen to be involved, and we expect to be doing a more formal expression of interest process over the coming weeks. Again, with this project, we are working closely with colleagues at NHSX to ensure that our work aligns and fits with work they're doing to explore use of the digital approaches to support individuals to monitor and improve their health. And so today we're delighted to be joined by our guest speakers, Tim Andrews and Jane Gurley from Orca, who will take you through the identification and assessment process and an overview of their findings. So as I said at the beginning, we have an hour for today's session, which will take the format of the webinar presentation, followed by a question and answer session at the end. And I'm now going to hand over to Tim and Jane.
Thank you. Andrew, do you want to move on the... Swiftly moving past that picture. Hello all. So thanks Jade for that. So yeah, Jane and I are just going to run through, it won't take too long to just run through kind of the process we've been going through, and then Jane's going to just describe the 10 products that we're currently looking at in the kind of final phase of the process, just as an overview. Then we're going to just touch on the kind of benefits that I think we're starting to hypothesize may come from these products, and we wanted to kind of discuss those really, and then as Jade said, open that up for discussion. So if we go to the next slide, Andrew, please. Yeah, so the methodology we underwent, used rather, was that we looked at, first of all, tried to find all products that we could from a whole series of different kind of routes and different search techniques, to as well as an open call, to find products that met the core requirements of the NHS Health Check, and those were, and they're described there, the key information capture. So all of the products that we've looked at and that got through this stage of the process had to be able to demonstrate that they could capture all of this information that is part of the health check. Similarly, on the information analysis, the products need to be able to demonstrate that they were applying those standard risk calculators and generating those various risk scores. And then on the information communication side of it, being able to also link to the information capture, be able to provide that communication. And some of them do that in slightly different ways, which we'll come back to in a minute. So all of the products that we're about to describe that got through the first stage of that process met all of those core requirements, and that was the key thing. So if we move on to the next stage, Andrew. We then took those, there was a slightly larger number of products at the time, through what we call the ORCA baseline review. So this is an assessment process that is used very extensively across the NHS and internationally, and looks at all of the key areas for compliance around digital health across the three primary review domains, as we call them: data and privacy, clinical and professional assurance, and usability and accessibility. One of the key advantages of the baseline review was it allowed us to do a detailed functional analysis that went, I suppose, checked the claims of all of the products that we took through to this stage. And I think there were about 20 products that we originally took through to this stage that all claimed they'd met those prior requirements that I just described. And through the ORCA baseline review, we were able to validate whether they did or they didn't. And as a result of that, that narrowed the list down to the 10 products that we're going to go through in a minute and just describe. So if we move on to the next slide, Andrew. The next stage of the assessment, and all of the products that we're going to take you through now have gone through this process, these next two stages, was to utilise the NHS DTAC standard, which some of you may be familiar with, and it was kind of only very recently kind of formally published in its final form. So, but we were already working towards an old model of the DTAC, and we've updated it to reflect the latest version of the DTAC, and that takes us through an assessment of the clinical safety, compliance of the products, more detailed analysis around data protection and GDPR compliance predominantly, some aspects of technical security, interoperability, predominantly focused on interoperability with NHS clinical systems, and usability and accessibility. Again, that's a build on the original assessment. So they've all gone through that process. And then the third stage, which ran in parallel with that, Andrea, if you want to move on from there, was a clinical evaluation. So this was trying to look at the products literally from the perspective of those of you who are doing these things on a day-to-day basis. So we're trying to put that clinical and practitioner perspective into the mix. And so that was undertaken by a nurse experienced in doing digital health assessments. Sorry, not digital health assessments, doing the NHS Health Checks, and she was able to look at the product set and really ask some, very kind of practical questions about what that would mean in terms of you guys on the ground, I suppose. So that was the assessment process, and that the products that Jane's now going to go through have all gone through those filtering stages. They all meet those core requirements, and we're just in the process of finalising and evaluating the results of the last two stages of that process that I've just described. So Jane, do you want to run through the ones?
Yeah, thanks, Tim. So these are our final 10 products. So I'm just going to talk about the main functionality in each of them, because some of them are quite extensive, so I might not be able to cover everything today. But our first one we looked at was integrated health systems. So this is a platform which has an online tool for healthcare professionals to carry out health checks. This is for the clinician to sort of add patients, then they can fill out the health data via the phone or within the community working with the patient, and then all the sort of analysis capabilities will happen, and we'll get all the risk scores, and then there's a report generated, and then that can be emailed directly to the patient's personal email address, or it can be printed out and given to them. There's also a separate report generated for a clinician, and then that can be emailed to the clinician themselves or sent to EMIS. For integrated health systems, our next solution was Ticker Test, and so this is a patient-facing platform designed for patients to sort of self-report their health information. So it's a simple and quick question-answer format. So they go through the questions for the health check and they answer them, and then they'll have a results page which will show the heart age and all the relevant scores. Within Ticker Test, there's also a practitioner dashboard which is available for the practitioners to see the list of patients and their current statuses. So, for example, if the health check's been completed, or if they've got sort of very sort of warning results that might be warning to them. The clinician can also request that a patient completes a health check by sending an invitation in the form of a text, which will include the link to the Ticker Test platform. If a patient is unable to report their blood pressure, they're redirected to a page which will help them to locate free blood pressure tests nearby, and then Taker Tests also aim to integrate a finger prick cholesterol test, where they would send the patient a kit. They could prick their finger and take a drop of blood and then send it back to get that analysed for their blood cholesterol level. So Andrew, if you want to skip on to the next one. So our next solution was QMS. So this is a patient-facing platform which replicates the NHS Health Check online. It captures all the data through patient self-reporting. So there's no direct clinician-facing side for this one. And the patient receives an invitation with the relevant hyperlink via text. The invitation process includes primers and SMS reminders, which are typically managed by QMS on behalf of the local public health team or NHS provider. The patient is presented with the results page and displays their heart age, risk, and whether or not they should book an NHS health check or an appointment with their GP surgery. So although it doesn't link in specifically with the GP surgeries, the patient is advised that they should go book an appointment if their results dictate so. Our next solution was WellMe. This is a patient-facing platform with a clinician-facing portal. Patients build their own health profile by answering questionnaires and self-reporting health data. The clinician-facing portal enables practitioners to view the health check information. And interestingly, with this one, the results can also data can also be collected through WellPoint kiosks and transferred and recorded on the health profile. So these are little kiosks which can be set up in sort of GP practices or pharmacies where the patient can go to and can put their information there directly instead of maybe having to download an app or have sort of access to a computer. And then WellMe also have additional features, for example, the ability to track and set goals and have access to health, well-being and financial advice. So they go a bit beyond the health check. So moving on to our next one, we have, I think we might have skipped one there. Yep, they've got MediStats, which is a health portal with an in-depth focus on cardiology, which is both clinician and patient-facing. So the clinician can complete the health check questionnaire on behalf of the patients if necessary, so if they're speaking to them or on the phone, or the patient can fill in their own health check questionnaires. And interesting with this one, you can also view data and there's notes between the clinician and the patient if there's anything that the clinician would want to expand upon. And at the end, a report is generated, which is quite lengthy. It's this solution goes beyond the health check as well and has inclusion of lots of different metrics and analysis, including the GAD-7 depression questionnaire. So it goes beyond the standard health check. Our next one was Dora, which is a telephone consultation platform which uses an AI chatbot to interpret what a patient says. This one's a bit different, so it works how a practice would initiate a phone call, and then sort of a patient's phone would ring, and then they would speak to a almost like a robotic voice to have the health check over the phone. So it will be kind of, they'll be asked all their questions, they'll be asked if they understand, and then they can carry out the check, and then the online platform will then carry out all the calculations, and then the results will be presented back to the patient over the phone that way, so they don't actually need to download anything or log on to anything. And then once the questionnaire is completed, they can request that the transcript from the consultation is sent to them, and it is also sent to the GP, or it can be automatically pre-filled sort of letters that the GP can send out if they would like to. So our next one is Health Check Cloud Suite, which is made up of a website for patients to access the questionnaire and a clinician-facing site, where results can be viewed and messages sent to patients. The questionnaire links are sent out to patients by the GP, and then the patient logs into the online system to complete their health check. The patient completes the questionnaire online, the results are calculated and displayed to the patient, and then automatically shared with the clinician-facing portal. The practice also gets an email summarising the results. And they also have a consultation module on Cloud Suite on their platform that can be used by clinicians with patients to guide them through the questionnaire. After the assessment, the patient can see their results in the form of a report which highlights areas which should be addressed by the patient. Their web platform also includes links to PHE resources, which include information surrounding health improvement, such as diet, weight loss, and alcohol consumption. Our next one was the Health Pod, which follows a similar format to a lot of the other ones, with a patient-facing questionnaire and a clinician-facing review portal. However, this one will accept readings from Bluetooth-enabled devices, like blood pressure monitors. So this solution can be installed onto a PC tablet for patients to complete the health check in a GP surgery waiting room. So there are multiple options, or the patient can download the application and do it in their own time. And when the assessment is complete, email alerts can also be sent by practice, and any results that fall outside of the set threshold will trigger specific alerts. So our final two were Quelth and Evergreen Life. These are mobile applications. So for Quelth, we have patient would download an app and complete the health check, and it's made up of various questionnaires to complete, and then provides an explanation of the result at the end of each questionnaire. Currently, the system is just set up so that the patient will sort of carry it out on their phone. However, the system does encourage the patient to seek GP advice based on the results of their health check, and there's the option to export the results into a PDF and email or take that to your GP surgery. And then finally, we have Evergreen, which offers a series of questionnaires to patients and gives insights. The app also interacts with their sister software called Evergreen Connect, where the information is automatically shared with the clinician after the test is completed. Invites to complete the health check are all managed from that software, and the practitioner can view the results in that as well from all their different patients. And there's also an option to file the results back into the patient record on GP systems. So just to summarize, Andrew, if you want to skip along. So overall, they mostly contain online questionnaires with self-reported blood pressure and cholesterol measures. Two solutions were only focused on recreating the NHS Health Check, but the rest all had additional functionality like wellness information or further analysis. And three of these solutions were actually still in development, so they were maybe deployed in some capacity, but not fully in the capacity to currently perform the NHS Health Check. But everything was ready to go and built, and they were just looking to be able to, find somewhere to do that. And one of the solutions was only practitioner facing. However, most of them had practitioner and patient facing components. So just to summarize, our initial long list contained 97 products, which we sieved through to try and find ones which met all the core requirements, which, as Tim said, was shortlisted down to 10 final products. These products have all been assessed through the ORCA baseline review, the DTAC, and been evaluated by a clinician. And the results of these assessments are currently still being put together and will be presented back to PHE to inform on their decision making. And I think now Tim's just going to give a quick overview of some of the potential benefits of an NHS digital health check. I think you're on mute, Tim.
You'd have thought I'd have learned by now, wouldn't you? So yes, I guess the ultimate question of all this is kind of what might these products be able to help with? And I think the process we've gone through has first of all tried to see, well, what products are available. So that's the core part of this process, which ones currently can do the job. And I think from there, we've started to identify with the PHE team the sort of hypothesized benefits that you could start to look at and probably test in the next phase. So obviously one of those is the option to improve the uptake of the NHS Health Check. And I suppose the rationale behind that is that these products offer much more convenience theoretically for individuals. They can engage with them at typically, or with some exceptions, they can engage with them when and where they want to. So accessibility is improved and all those sorts of things. So that's one kind of hypothesized benefit, which would mean that, you know, health checks can be more easily engaged with, possibly. Secondly, obviously these could be providing efficiencies in terms of data collection, and therefore saving time, you know, during the actual health check. So you don't have to do so much of that initial data collection element. That can be essentially done pre a health check, with the patient or service user doing it directly. Thirdly, and similarly, obviously some of them or all of them should be able to provide those risk calculations, and again, depending on how that's currently working in your particular area, that can provide some efficiency in terms of just speeding up that process, creating more time for the actual other aspects of the consultation. Products that then some of these products then kind of move us into areas like being able to improve signposting to relevant services. Now, some of this might just be an alternative to walking out with a set of PDFs or, you know, some physical material, telling you the things that you'd normally expect to be advised post the health check. Whereas here, obviously, these products have the ability to do that digitally. And also to probably bring in a broader range of potential resources and signposting options, including, for example, the ability to signpost to other digital products that might be useful to address some of the issues that the health check's focused on. Then there's also and this is kind of, I think, moving into an area that could be really exciting, but definitely needs more thinking about the idea that actually the products do lend themselves more to, or potentially some of them do, to an ongoing health assessment. So instead of kind of that point in time health check kind of example, you could start to think about these as being things that are actually just regularly updated and interacted with, and therefore you're not necessarily looking at a single snapshot in time, but possibly more of a longitudinal analysis, and the opportunities around that could be significant. And of course, some of them already do, but there's also the opportunity to include additional risk assessments and to bring different things into the environment of the health check. So, for example, things like atrial fibrillation screening and that kind of thing can be included. We know there are digital health products that do that with a high degree of accuracy. And there'll be many other things that you could possibly start to bring into that health check kind of umbrella over and above what's already there. So some of those are the possibilities that we've started to see, both from the products that we've identified and also more generally through the process that we've been going through. So that was it really in terms of the summary from about where we've got to. And Jade, Rosie, I didn't know whether you wanted to provide any final thoughts on that bit.
Thanks, Tim and Jane. That's a really comprehensive overview of what has been quite a thorough identification and assessment process. It's really good to see some of the overviews of the products as well. I just wanted to let the audience know before we open up for questions that there will be a kind of a report published which will include some of the detail on the process and the shortlisted companies in due course. We're obviously not able to discuss kind of individual scores during the webinar, but I think, you know, it would be really useful to try and kind of open up now for some questions, and we can do that. Andrew, are you okay to stop the recording now?